Dr. Tracey Bovell, nominee for the Organization of American States, OAS, awards and lead doctor in the Infectious Disease Hospital at Linyandal, expressed her concerns for persons who are yet to be vaccinated for COVID-19 during an exclusive interview on Tuesday with Nightly News. According to the Ministry of Health, 86% of adults have received at least one dose, while 64% are double vaccinated. However, for Dr. Bovell, there is still a dire need to press for vaccinations in Guyana to achieve a zero-case result. In her efforts to reveal the truth behind the growing cases, Dr. Bovell expressed that the majority of persons admitted as COVID-19 patients at the hospital are either unvaccinated with comorbidities or partially vaccinated with comorbidities.
That the majority of the persons admitted into the hospital, not only at the Linyandal facility but at all of the isolation sites, are persons that are unvaccinated. They are either unvaccinated with comorbidities, or they might have started their vaccination process, not completed their vaccination process, and have comorbidities. Of course, you have those that also will be vaccinated and have comorbidities, but we're talking about the majority of the persons being unvaccinated.
With COVID deaths at a count of 1,231, the OAS awardee further emphasized that the majority of COVID-19 deaths are persons that have comorbidities and are unvaccinated.
We're also looking at the majority of our deaths are persons that have comorbidities and are unvaccinated.
Dr. Bovell, in addressing the stigmas attached to the COVID-19 vaccines, noted that the type of vaccine a person decides to access is irrelevant. What matters, she posited, is the need to protect oneself from this pandemic, and it should be the interest of all Guyanese to become vaccinated.
We're not interested in your traveling so much. We're interested in your health and taking care of you and avoiding you getting this very deadly, very ill disease. That is the main aim of the vaccination process. Well, one of the main aims of the vaccination process. It wasn't really thought of to, okay, so you cannot travel to Latham or you can travel to Kingston. That is not what someone would think of when you're thinking about a vaccine. You're thinking about saving that person's life.
Even though mistakes are likely to occur, Dr. Bovell is recommending that, coupled with the COVID-19 vaccine, that all Guyanese practice healthy preventative measures to rid Guyana of COVID for good.
You can make mistakes. These things do happen. But you try to avoid it by continuously washing your hands, sanitizing your hands, and avoid touching those areas.
This is Tarik Braithwaite reporter for HGP Nightly News.